Mast cell activation syndrome by Iris Klein.
What is going on here? Are we a really unlucky family? I've been diagnosed with fibromyalgia, Ehlers-Danlos syndrome, and irritable bowel syndrome. My symptoms include diarrhea, weight loss, and acne. My sister gets lightheaded easily and struggles with diarrhea and stomach pains. Mom, on the other hand, gets constipated, has dry eyes, and a left hand that doesn't work properly for the first few hours of the day. We all struggle with migraines, nausea, and sore throats. Grandma? Well, she has too many problems to list. I have recently heard of a disease called Mast cell activation syndrome, or MCAS, and this one disease encompasses my family's symptoms. Why is this important to you? Dr. Lawrence Afrin believes this condition affects 14 to 17% of the population.
Mast cells are found in connective tissue including skin, the stomach, and the gastrointestinal tract. Mast cells contain histamine and interact directly with bacteria. They provide allergic immune response signals. These signals produce clone mast cells. MCAS releases too much histamine during inflammatory and allergic reactions. This happens when the cells are exposed to stress or danger. Mast cells respond by releasing an overproduction of mediators.
Mediators cause inflammation. They help your body heal from an injury or infection. But an overproduction of mediators may look like this. As all these yucky mast cell toxins are dumped into the histamine bucket, the histamine tolerance overflows the bucket.
Too many mediators can cause episodic and chronic symptoms in almost every system in your body. People often experience a step change in symptoms after years of mild symptoms. Over 70 symptoms have been noted, including these displayed. Dr. Lawrence Afrin says, quote, "MCAS is a chameleon, difficult to identify for many reasons. It presents with different symptoms to different degrees in different places in the body."
Triggers may include high histamine foods, insect bites, stress, temperature changes, fragrances, autoimmune diseases, lack of sleep, bacteria, mold, and more. Symptoms can be alleviated by avoiding high histamine foods such as alcohol, vinegar, citrus, aged cheeses, fish, smoked foods, and egg whites. Mast cell stabilizers can also be used as a treatment. Stabilizers are medications used to prevent or control certain allergic disorders. Stabilizing the cells prevents the release of histamine and related mediators. To be diagnosed, symptoms must affect at least two body systems. Blood or urine tests can be performed during an episode to show elevated levels of mediators. Getting diagnosed can be complicated because most doctors are not trained to identify a disease that reveals itself in so many different ways. Finding a medical doctor who is willing to explore diagnosis and treatment is the most important first step.
I'm raising awareness for this disease that affects many people. I understand the frustration, but MCAS brings me hope knowing my symptoms are caused by a single underlying disease. I encourage everyone to be honest with your symptoms, ask your physician questions, and most importantly, don't lose hope.